When setting up for an arterial line, you'll first need to stop by the PICU PAR. Here, you'll find your Vamp Jr transducer as well as your pressure bags. Then, you'll go to the Pyxis and pull out your arterial line fluid. And don't forget your tape for labeling. To set up, pull your fluid bag through your pressure bag and attach to the hook. Then hang it on your IV pole. Look for the blue pigtail and 3 cc's on the back of your package to make sure you have the right one. Always check your connections to make sure they're tight when you first take them out. Go ahead and roll your roller clamp closed and spike your A-line bag. Now with regular IV tubing, once you unroll the clamp, your fluids will start priming itself. But that's not the case here. As you can see, there's no fluids priming through the line. The trick is you have to pull the blue pigtail, and once you do that, you will then start to have flow. Here we have bubbles, yay, and the line's getting primed. Make sure the reservoir is also primed and there's no air in it. In order to do that, it's helpful to turn it to the side like this and prime all the way through. Then you'll want to prime through your port by turning off to the patient, pulling the pigtail, and then opening back up. The only thing you'll need to add is a 10 cc syringe. Here, you're going to attach it to the port that you just primed. You're going to turn off to the patient, and then you're going to prime that by pulling the blue pigtail. The first time you do it, you might need to help it a little bit, but after that, it should prime pretty much on its own when you pull the blue pigtail. Make sure to turn off to the syringe so it's back open. Then push down on the reservoir to lock it in place and that the blue plungers to the bottom. Now go ahead and slide your transducer into the pull clamp, obviously in the red side for arterial line. And you want to make sure that your cables are facing up. Now inflate your pressure bag by turning the stopcock off to the port on the right and pumping manually. Pump until the little thing turns green. Then turn your stopcock off to the pressure bag. Now you're ready to connect to the patient. You want to make sure to clean with CHG really good. Then you're going to connect both ends and then make sure that you're unclamped at the site, that you're opened on your line, that you're opened at the transducer, that you're unrolled, and that your pressure bag is fully inflated, and that your transducer is level with the heart. These are the cables we use. Connect one end to the transducer and the other end to the monitor. Now we are transducing the patient. Follow for part 2 to see how to zero.